Welcome to the Pot.Live podcast. I'm your host, Lenny G. This podcast is all about connecting the community with the thought leaders of business and entertainment in the cannabis industry. As this industry expands and becomes more and more mainstream, we want to educate and entertain our listeners and become your choice and voice for all things cannabis. Thanks for joining us and enjoy the show. Have you visited MJ.com? MJ.com is the online destination where you can find everything you need to know about the emerging legal marijuana industry. Where else can you find the latest original content, news, and trends? Connect to a local doctor to obtain your medical marijuana card, receive exclusive brand savings, and have your favorite product delivered straight to your front door? MJ.com has it all. Go check them out. Welcome to another episode of the Pot.Live podcast. I'm your host, Lenny G, and today our special guest is Dr. Leigh Vinocur. She is a certified ER doc or semi-retired, and now she is continuing her education with the newest Medical Cannabis Science and Therapeutics program in the University of Maryland, the master's program. She has a broadcast and journalism career. She's an advisor for several people getting their licenses. She's going to tell us all about it. Doctor, welcome to the show.
Thank you for having me, Len.
Excellent. So why don't you give our listeners a little background on who you are first, and then we can dive into all the great things that you're involved in.
Sure. Well, I had been practicing medicine for 20 some odd years and was at the University of Maryland. I was also working on faculty and helping the dean of the School of Medicine and Public Affairs. And I was actually, because of some of my adjunct media career, I was helping a researcher who was about to go to press with a paper that was publishing and looking at endocannabinoid levels in stressed rats. And I was like, I said, what are you talking about? I mean, I had been doing academic medicine for years. I go, endo what? You mean like endorphins? We have endocannabinoids? And I was just so shocked. I'm like, why are they not teaching this in medical school? Why am I not hearing about this? And this was, I don't know, probably back around 2008 or so. It wasn't, legal yet in Maryland. It took more than 8 years for that. So I was so intrigued. I started reading everything I could in basic science, learning about how it was integral to our homeostasis. And, while I had always believed in decriminalization because the prosecution unfairly was kind of decimating our inner cities, unfortunately, as an ER physician who worked in Detroit, worked in Baltimore, I had seen the issue with drug addiction. And I, because of what we were trained in during medical school and residency about the dangers of drug addiction, I was embarrassed to say now that I had this misinformed belief and prejudice that marijuana was an addictive, dangerous substance. And we didn't have meaningful data back then. And even now there's a lot more of it, but there was a paucity of data supporting its medical use. Rightly so, because it's federally illegal and it's listed as a Schedule I drug, which is supposedly means it has no medical use. So that was kind of part of it, but I got very interested in it. And one of my colleagues who was a state legislator, who's also an ER doc, brought about the legislation, and I helped him and helped some groups with their applications in Maryland. But that was fast forward 2016, so it took a while.
What is officially legal in Maryland right now?
Medicinal cannabis. It's decriminalized, and medical cannabis is what's legal. And, as a board certified physician, you really didn't have options for formal, medical school education, residency training. So I kind of took it upon myself. And before I started a small practice here in Maryland. I traveled around the country, so I went to California and I trained and studied a little bit with the top pediatric cannabis doctor in the country, Dr. Bonnie Goldstein. I traveled to Maine. My son was in college there. I stayed and I trained with Dr. Dustin Sulak, who's another top cannabis physician. I joined the Society for Cannabis Clinicians and got certified through the Medical Cannabis Institute and tried to absorb and learn as much as I could for my patients and to help consultant industry. And then University of Maryland School of Pharmacy, which is one of the top pharmacy schools in the country, offered just last year the first in the country Masters of Science in Medical Cannabis Science and Therapeutics. So I couldn't pass up that opportunity, and I'm actually enrolled in the program now. So it's a fabulous program. It's taken our country, such a long time. It's still sad that, each state had to take this upon themselves individually to really look at it because, my physician colleagues, they want data, they want science, they want meaningful research for best practices. And that's why I got involved in this, and I'm hoping to someday teach, be involved in research. I mean, there are great researchers out there, Dr. Ethan Russo, that were pioneers, Dr. Raphael Meshulam in Israel. They're pioneers, but we need more of it to bring more legitimacy. And obviously, the federal government has to help with that, and that's what slowed it down. So,
yeah, it's true that you say all the states have to kind of go at this, by themselves, which is creating the Wild West out there. All of the laws are different. All of the license regulations are different in every state. I wanted to ask you about the program that you're in and what they're teaching you in this master's program. And I'd also, as a follow-up, like you to explain how the licensing process works in Maryland. Is it a vertical license? Are there delivery, distribution, and grow licenses separately? If you can just touch on that a little bit as well.
Yeah, sure. So the program is fabulous. It's teaching the actual pharmacology behind medical cannabis and therapeutics. It teaches the laws and teaches the history behind how it became decriminalized. As an ER physician, what really made me decide that this is what I wanted to do and pursue in the next kind of phase of my career was seeing the opioid crisis unfold in front of me and how we as physicians unwittingly contributed to that because we were trying to help our patients with pain and suffering. And I really started to feel betrayed by federal agencies that I thought were set up to protect us and our patients, and they really were protecting pharmaceutical companies. So that was what really kind of was the straw that broke the camel's back for me about wanting to do it. And also from a personal space, I cared for my mother when she was dying of cancer back in 2016. And had I known then what I knew now, I would have moved to California with her to kind of ease her pain and suffering. So, and all the people in my program, they have these stories about this. So it's really looking at the science of medical cannabis and therapeutics through the lens of clinicians and pharmacists, even though the program is not specifically just tied to people that are medical professionals. There are doctors in it, there are pharmacists in it, but there are people that work in dispensaries and such. And it's teaching everything that we have out there related to medical cannabis. I mean, it's a wonderful pharmacy school. They have a fabulous dean, Eddington. They have great professors there. And Dr. Leah Sarah is the program director, and they've done a great job of doing it. In fact, all the courses, you can't take all of them offered, to get the master's, but they have so many great courses. I feel bad that I don't have enough time to sign up for all of them, but they're doing a great job, and I really enjoyed it. And in Maryland, they did the licensing. They had opened it up once, and I think they did a second round of it. It depends on what you can apply for the vertical of all of it. And there were a few companies that got the vertical of all of it, but some people just applied for dispensaries. So it really depended, but they did it. It was legalized for medicinal cannabis, I believe, back in 2016, and then it took about a year or so to get people up and running. I helped with a couple applications of people that I had met along the way, talking about education and things like that with their staff, and part of the medical parts of it I helped with. And then they opened it up again because there were some issues about who got the licenses and to create more diversity and equity in some of the licenses. So there were like 2 rounds of it. But you could apply for a full vertical of growing, processing, dispensary, or just an individual licenses.
So what's the process for a patient in Maryland? Do they have to meet with a doctor, obtain their medical marijuana card, I assume, and then how do they get the product? Do they have to go, is it recommended from a doctor? Do they have to go to a dispensary and educate themselves? And can it be delivered, or do they have to go pick it up?
Yes. Well, and that's why I wanted to get involved as a physician, and what I learned from Dr. Goldstein and Dr. Sulak. I really try and recommend. There are no prescriptions, as we know, because it's still federally illegal. I really try and recommend and take the time educating my patients early on. There are some places that have opened up that, are certifying people, but I really spend a lot of time educating. My average patient is over 80 years old. So, and they're used to, you take a pill and that's it. And that's not how medical cannabis is at the present. So I spend a lot of time with my patients going over the endocannabinoid system, what cannabis can and can't do. I'm a big believer in tinctures. I recommend that as opposed to vaping and smoking, and then trying to explain to patients milligrams per milliliter and how that works and how to increase the dosing slowly. But it's difficult for patients because that's not how they're used to taking medication. But they come in, we do a whole interview. I take an hour, sometimes an hour and a half, really educating them the best I can on cannabis and making specific recommendations, like look for a tincture that has this concentration. And, I give them these little oral dosing syringes, and you're going to pull up this much, and that's how many milligrams. And it's intense and it takes a long time. And then they go to the dispensary. I've had a lot of dispensaries or patients call me back and say, oh, thank you so much. It was so specific and it was such great instructions. Because I am afraid in the state, there are people that just get certified and then, they go off to dispensaries and they don't understand really how to take it, how to dose it. We don't have a pill like aspirin and you take this 3 times a day and that's it. So that's why I think the program at the University of Maryland is so great too, because it's trying to advance the science, the medical science behind cannabis. But then they'll go to a dispensary. They can get approved online from me once I've seen them in person. The first visit in Maryland has to be in person, although now with the COVID-19, I think they've changed that. So you could do a televisit the first time in Maryland. They're sending out new regulations all the time for it, but we're still sheltering in place. So that's part of it. And then once they get approved, they'll get the card in the mail. But if I go online and approve them, if they've applied before they came in, I can print up a piece of paper and they can go to the dispensary with it. But it is very confusing. And there are some dispensaries that maybe their staff isn't as educated on condition specific and dosing and things like that. So, you have to be careful, and especially for the elderly, which I'm seeing a lot. Like I said, the majority of my patients have these chronic pain conditions or things like that, and they're older. I'm very cautious. You have to tell people they have to be careful when they take it around their medication because, there is oral ingestion of cannabis is affected by first pass of the liver and can affect their other medicines. So those are some things I worry about if there are providers out there that aren't taking it seriously and aren't really getting educated on it.
Yeah, the education of the physicians is super important, and more platforms are, coming out to help that process along. So are you seeing in your patients, are the patients actually interested in being educated on the different types of strains and reasons to take cannabis, or they just want it like, give me something now and I just want it now, I don't really care what it is, just hand it over or tell me what to get?
No, because as I said, the majority of my patients are the elderly, right? And they're used to having a physician-patient relationship. So, they can call me at any time with questions. They like that I'm taking a long time to talk about it and learn what they could use it for and how it might help them. And they have a lot of questions, do they want to go someplace where they can have a relationship with their physician and ask those questions? So I make myself available via phone after we've seen them, after I've seen them, to spend the time. If they have questions, they can come back in and talk about it, or we can talk about it on the phone. I check up on them too. I have them call me after the first week to see how they're doing, and then 2 weeks after that, and we do a real slow progression on it. And, I make sure they keep track of everything so that we can talk about it. But I would say that the majority of my patients, since their average age is in their 80s, they want that relationship and they want to learn about it. And they're, a little afraid and they want to go at it slowly.
So let's give our listeners across the country that may not be in Maryland a few tips. I guess anxiety and pain relief are probably the top two reasons people want to try medical marijuana. Do you have any specific strains that you've seen work for your patients or that you recommend they pick up in a dispensary that work for either anxiety or pain relief?
Well, I technically mostly recommend oral and tinctures. And I would say that since the majority of my patients are in fact elderly, a lot of them are not interested in smoking per se. So when we talk about what to use, it isn't so much in the strains. We just talk about, the anti-inflammatory or analgesic properties of cannabis. We talk about if you're looking for an oral tincture, perhaps that, maybe you want to think about these types of terpenes in them because they additionally have anti-inflammatory things. We talk about, the entourage effect. So when I talk about it, I might say if you need something a little bit relaxing, look for things with myrcene in them. And there are some great tinctures here. So it's hard to, truthfully, one of my pet peeves about cannabis medicine, and I don't know whether other doctors feel that way and how growers feel, is I feel if we really want to legitimize it as the medicine, we need to number the strains. We can't have these crazy names, and we need to get some kind of standardization. And it's hard because it's not, each state, it's a little different. And, there's a researcher, Didi Meyer in Israel, that talked about, each strain that has different variabilities in the actual cannabinoids and then in the actual terpenes in it can affect, diseases in different ways. I mean, there's examples of patients that you think you have the same ratio, but the growing conditions might be a little bit different. It's very difficult. Botanical, I've always said, all medications started from botanicals. The reason the pharmaceutical companies started to make synthetics of that is it's really hard to get standardized quality, decrease the variability related to growing botanicals and getting extracts. But that's part of pushing the limits of science that we're working on now. So it's not like I would recommend a strain. I would just talk about, you want these ratios. If you don't want a lot of the psychoactive effects, you want to think about these terpene levels, and you want to look for tinctures that have that. And actually, Dr. Dustin Sulak, that I went to train in, who's one of the top cannabis physicians in the country, in Maryland, and I don't know why it's not in Maine yet where he practices, but in Maryland, he has this great tinctures that I recommend a lot, and they have differing ratios of THC, CBD, even THCA, and he has a pain relief formula, and he labels them great, so this is impairing and this is not impairing, and so I use his healer tinctures a lot. But if they go to a dispensary that doesn't have them, I tell them, I want you to have this ratio 10-1, 5-1. THC to CBD, look for something that might have these terpenes and things like that. But I am a big believer that we have to change these crazy names that people have out there, Alaskan thunderfuck or something. These are 80-year-old people that are trying to get medicine, right? Yeah. And we have to try and standardize it. We have to say that, this strain B or strain 137.5, because there's so many, has this ratio of cannabinoids, this amount of terpenes in it, and we know that it can be used for these conditions.
Yeah, I think that's a great idea, actually. Just have sativa 1, indica 2, whatever it is, A, B. That's so much easier than all the crazy names and hybrids that people are creating day after day, because most of those new strains that are created are really for the recreational market. But for the medical market, right, you can just have, like you said, sativa 1, indica 2, and down the line, and this does this, and they can just look up a chart. Here's my symptom. Here's what this one does. I'll try that one and go to a dispensary and have it labeled as such. That would be so easy for the new patient.
Yeah, and Dr. Miri in Israel, he's trying to do that, to create a huge database. I mean, we need something like a database that talks specifically of exactly what is the composition of this type of strain and how do people react to it, and is it good for this condition? Because botanical medicine is tough. I'm a medical science liaison for another nutraceutical company, and it's difficult formulating botanicals. And once it would become legal federally, then you could have great organizations like U.S. Pharmacopoeia verify the way they do with really reputable companies for vitamins and supplements and nutraceuticals. That's what's going to kind of bring it out of the shadows and make it much more palatable for physicians everywhere, and safer sometimes too.
Yeah, I agree. Okay, Doc, so tell everyone, if they want to follow you on social media or get in touch with your team, what's the best way for people to find out more about you and your team?
Well, I'm on LinkedIn, and I do consulting work in the cannabis industry too. I'm not a big, Ananda Medical Practice is the name of my practice. There is a website there, for people in Maryland to go there and set up an appointment and such. But I have to admit, I'm not big on Twitter or anything like that. But
that's okay. That means they can come right to this podcast and learn everything you like to tell. So that's great. All right. So before we finish up, tell everyone what's something you're excited about in the cannabis industry overall or the medical community, and what's something you're concerned about?
Well, so I'm concerned, as we've been talking, Len, about trying to create something that is more scientific. That's like, I try my hardest to give condition-specific recommendations with more exact dosing for patients, especially as older patients start to venture into this. So we need, as a medical community as a whole, to realize this, to stop, pointing fingers and get rid of the stigma and really try and use it to its best advantage. And that's part of what I'm excited about. There are people like Dr. Ethan Russo out there who started a new company helping to legitimize it. And I think my program at University of Maryland School of Pharmacy is doing that same thing. So that's part of the excitement.
Great. Excellent. Dr. Leigh Vinocur, thank you so much for taking the time today and being our guest.
Thank you for having me.
And we'll see everyone next time on the Pot.Live podcast. Have you visited MJ.com? MJ.com is the online destination where you can find everything you need to know about the emerging legal marijuana industry. Where else can you find the latest original content, news, and trends? Connect to a local doctor to obtain your medical marijuana card, receive exclusive brand savings, and have your favorite product delivered straight to your front door? MJ.com has it all. Go check them out.